The host has unmuted you. Very good. Well, everyone, I want to thank you for being here. My name is Manny Rivera. I'm the Kaiser Permanente Medicare Specialist. The areas I cover are the San Fernando Valley and the Ventura County area. And I want to really thank you. And I appreciate the city of Fillmore allowing us this opportunity to just reach out to the people of Fillmore and to also mostly educate you about Medicare. Medicare is something you spend your entire life working towards and you're eligible for, but really should understand. And it's one of those things that many people kind of fear or don't understand, or they think it's a little too complex. And our purpose today for gathering is to help you simplify it and make it easy for you and to really understand how it can be used in the right way. So we're going to cover a lot of the do's and don'ts of Medicare, okay? Medicare is something very special in this country because, again, you work hard all your life towards it and you put money into it. And you do need to understand how it works. If you do something wrong, you could end up with a penalty or not using it to its full advantage. And you need to know how it works. So today's gathering is to really help you understand a lot about Medicare and the different parts of Medicare, okay? What I would like to do now is I'm going to share my screen and we'll be going through this and kind of covering this. But, and also I want you to feel free to reach out to me or Kaiser Permanente, our Medicare Senior Advantage Department as well. Our toll-free number is 1-800-600-4182. So should you live in the Ventura County area, Los Angeles County area, or the Kern County area, feel free to reach out to us because we'll be there to help you and answer your questions, okay? To reach me directly, my phone number is area code 818-968-1575, okay? But let's get going. I'm going to share my screen right now, and I've got a lot to talk about and cover here. And so let's get going on this, okay? So let me hit this little button here, and I think that's going to bring us exactly what we need here. So this is a Medicare 101 presentation, and it's presented by Kaiser Permanente. And this is a great thing to know, again, because you work several years all your life towards Medicare. And people will often say, when do I get it? How does it work? Is it expensive? What does it cover? I'm so confused. And this is something people kind of set aside and ignore until it's too late, and they don't use it to their full advantage. So let's step back and talk about what is Medicare and who can actually join Medicare, okay? Who's eligible? Well, first of all, Medicare is for individuals when they turn the age of 65, for the most part. Now, when you work, you put money into Medicare, and most people receive Medicare the first of the month of their 61st birthday. They're eligible for Medicare benefits at that age. Now, you can receive Medicare if you are under the age of 65 and live with a disability. In other words, if a person is 55 years old and they become disabled, permanently disabled after 24 months or 2 years, they may be eligible to receive Medicare to help cover their health costs, their insurance costs, okay? So, and to receive that, of course, you need to be eligible for Social Security and be disabled. Now, an individual that also suffers from a particular illness as well may be eligible for Medicare. And those are individuals that have an illness that's named after a famous baseball player. You know, one time I was at a seminar and I asked somebody who's eligible for Medicare, and people say, oh, you have to be 65 or you have to be disabled. And I said, yes, but there's also one other reason. It's named after a famous baseball player. And somebody yelled out, Babe Ruth. Well, it's not Babe Ruth. Okay, it's Lou Gehrig. Lou Gehrig suffered from an illness that was nicknamed later on or named Lou Gehrig's disease. And if you have that particular illness, you also become eligible for Medicare. Okay, now a little more about the history about Medicare. Okay, what is Medicare? Well, you have to understand Medicare is federally funded. It's a federally funded health insurance program. Okay, it was established in 1965. I'm sure many of you remember in the 60s who was president. It was Kennedy, right? And after Kennedy came LBJ, Lyndon Baines Johnson, and that's when Medicare started in 1965. It's administered by the Center for Medicare and Medicaid Services, otherwise known as CMS, okay? And when you become eligible for Medicare, Uncle Sam says, hey, congratulations, you're eligible for Medicare, okay? And you'll receive a card in the mail. And again, most people receive this card in the mail. And if you have Social Security, you'll receive it. We always recommend that you contact Medicare or Social Security a good 2-3 months before your 65th birthday to make sure it's on the way to you. So that's very, very important. So often I get asked a question is that, Manny, I got my Medicare card. I see it says hospital and medical, but there's just 2 parts. What's going on? Well, Medicare is actually made up of 4 parts, but there are 2 original Medicare parts, and that is Part A and B. And let's talk about that. You have Part A to help you during hospitalization. We're going to get into details about that in just a minute. And you also have Part B, which is for medical insurance. That's for your outpatient medical care. And years ago, along came Part D. D is for drugs for medications. And I'm so glad Medicare did this years ago. And we're going to touch on also Part C, and that's Medicare Advantage, which also includes all the other parts. Okay, so let's kind of step back and look at Part A. So here you are, you're turning 65, and Uncle Sam says, hey, you're turning 65, here's your Medicare card. It includes hospital insurance Part A. So now that means that you've worked all your life and you've put money into Medicare and you have benefits that will help insure you towards being in the hospital. That does not mean that if you walk into a hospital with your Medicare card, everything's going to be paid 100%. You really need to look at what they will be covering. There are deductibles depending the length of the stay you're in the hospital, but it will give you coverage for inpatient hospital care. And aside from that, will also help you for skilled nursing care, hospice care, and home health care. Okay. Now, many people will say, oh gosh, I got my Medicare card. That's great. But what's it all going to cost me? Well, you have to understand, you've actually paid into Part A. It is yours. So you won't have to pay a premium for your Part A. It's given to you. Okay. Now, to make sure you qualify for Part A, please contact Social Security. And here's how you would be qualifying for Part A. You have to work and put money towards Medicare and, of course, towards Social Security for at least 10 years, or what Medicare calls 40 quarters. 40 quarters, that's 10 years, okay? But if you didn't do that, all right, you could be charged up to a monthly premium this year of $458 a month for it. So you want to make sure you contact Medicare and make sure you're eligible. Now, another thing you should also know about Medicare. I work and I put money into Medicare. Every time my employer pays me, money is deducted for my Medicare. However, money is also deducted for my spouse. And my spouse will also be eligible for Medicare because I have put money into Medicare for her. Okay, so she'll be eligible at the age of 65 as well. But Part A is wonderful. When you receive it, it's yours, it's theirs, yours to use, and it doesn't cost you anything. You've earned it. All right. But keep in mind, it's for inpatient hospital insurance and, of course, skilled nursing care, hospice care, and home health. Now, let's talk about medical insurance Part B. And I want to emphasize something. On your Medicare card, it will say medical coverage, medical insurance. It does not say Medi-Cal. Many times people will say, oh, I got Medicare and Medi-Cal. Well, Medi-Cal is a separate thing altogether. And that we're really not going to talk about today. Medi-Cal is also known as Medicaid, and that's where the state of California gets involved to assist you to help you with your health coverage. But we're talking today about Part B of Medicare, and that's for medical insurance, okay? What it does is it covers doctor visits when you have outpatient medical care outside of the hospital, and it covers your doctor visits and also covers other healthcare provider services, okay, such as lab and other services, okay? It also covers you for things like wheelchairs, walkers, and crutches, also known as durable medical equipment, dialysis, and many preventative services, okay? So Part B. What does it cost? What is my monthly premium? It usually is deducted from your Social Security. If I retired 65 and I'm receiving Social Security, Medicare will be taking money out of my Social Security for my Part B, okay? How much they take out is actually based on my income, okay? On average, people have a certain amount that they pay when they receive their Part B. And you can actually look on Medicare.gov, and it will give you a chart right there. And based on your income, how much they'll be taking out. Okay. Now, that's a monthly premium that's deducted all the time. Now, Be very careful. Let me explain. In the 25 plus years I've been here at Kaiser Permanente, I've ran into this. I ran into people becoming Medicare eligible. They feel that they need to pay their Part B and they pay it every month faithfully to Medicare. That's great. The problem is that they're still employed and they still have credible health insurance through their employer. So there's no need for them to be paying their Part B, but people still feel that they should. They're afraid that they're going to get some sort of penalty if they don't. The problem there is many months or years will go by, and then they'll enroll into a health plan, well, such as Kaiser or another health plan, and they're eligible, and we enroll them, and we have to tell them, you've been paying into Medicare all these years that you shouldn't have to, and all that money is literally gone. Okay, so if you are going to have credible coverage through your employer or your spouse, you really can notify Medicare and say, Medicare, thank you for the Part B. We appreciate it. However, currently I don't need it. I have credible health coverage through my employer or my spouse's employer. And when that ends, you can actually notify Medicare and they will start your Part B up again and you will not have a penalty. Okay, so that's very, very important. So there's no reason that you should be paying your Part B penalty for that. Okay, so that's very, very, very important. We don't want you to be paying that. Now, I have seen some people do this, and please do not do this. I've met people that tell themselves at the age of 65, well, I'm eligible for my Medicare. I have my Medicare card. Uncle Sam wants to charge me for my Part B, but why do I really need it? I'm perfectly healthy. I'm never going to get old and sick. That's just not going to happen. Even though I don't have coverage through an employer group or my spouse is not insuring me and I have no health coverage, I don't want this Part B. It's kind of optional. I'll just tell Medicare I don't want it because, I'm young, I exercise, I eat well, I'm good looking, any kind of excuse they can not to get their Medicare. Okay. And Medicare will say, well, it's optional. If you don't want it, we can't make you get it. Okay. But the reality is this: what happens to us when we get older? We get sick, things start going on, right? So what happens there is this: a person will then, in their late 60s, 70s, maybe even in their 80s, run to Medicare and say, you know what? When I was 65, I didn't want this Part B, but I really need it now because it turns out I can't have any health insurance unless I have my A and B. And Medicare will say this: well, you know what? Currently, it's not time to sign up for Part B. You have to wait till next year in January, February, and March, because that's called the general enrollment period when you can apply for your Medicare. So if today we're in the month of April and I did that, Medicare would say, come and sign up for your Part B in January, February, and March. And then when I go to sign up for it next year in January, February, March, guess what? It's not going to begin till the following July. That's right, July of next year. And guess what? Whatever that Part B cost, it's going to be more. And I will be charged a penalty. That's right, a penalty of 10% for every year I was not on that Part B. And that penalty is to be paid to Medicare every month for the rest of your life. And you're really going to feel that. So be careful. Okay. So we encourage you not to do that. Be sure you have some form of health coverage. Okay. So again, remember, if you do in fact have health coverage and you continue to work after 65, you can notify Medicare that you don't need that Part B yet, but you definitely should get it once you decide you're going to retire or lose your credible health coverage, again, either through your employer or your spouse. Okay, we encourage that. Okay, so you have up to 8 months to get that Medicare. All right, so let's move on. So Medicare coverage options. Okay, here are some ways you can get Medicare coverage. You can get original Medicare coverage through the Center for Medicare, CMS, okay, Center for Medicare and Medicaid Services, okay. You can get a supplement to the original Medicare, what's called a Medigap plan. That's very common, okay, all right. And Kaiser Permanente does not offer a Medigap plan. Kaiser Permanente is a Medicare Advantage plan, and that's what we're going to talk about in a minute. That's Part C. So you can sign up for a Medicare Advantage plan, also known as Part C, through a private insurance company, and that would be someone like Kaiser Permanente, okay? And in some parts of the country, you can sign up for a Medicare cost plan, not here in Southern California though, which are also offered through private insurance companies. So let's talk about Part C. Part C as in Charles. All right. What it does, it combines your benefits from parts A and B and Part D as well, in some coverage it does here at Kaiser, in a single plan. And it's an alternative to original Medicare. The good thing about that, it's cost effective, if the cost is predictable, there's no surprises, and you utilize the services at our facilities, okay? Services are under one network of providers that you must use, okay? So now what does it cost? Well, okay, so you say I put money into Medicare. Uncle Sam is charging me a monthly amount for my Part B. Now, aside from that, what does it cost? Well, Medicare actually pays an amount for your coverage every month to the private health plans, okay? Medicare Advantage plans contract with Medicare, and every month Medicare sends them a payment to cover you for those services, okay? It's just the same as if you were working for an employer group, a company, a corporation, a business, and they were paying a health plan to insure you. In this case, it's actually Medicare, all right? So, and to actually qualify, you need to have your Medicare A and B and live and reside within the service area. So that's fine, all right? Not a problem. Now, some health plans do have additional monthly premium. Many plans, you pay a copayment for covered services, and that's very true. In Southern California, monthly premiums for several plans are zero, including Kaiser. Depends which county you live in, and and also your benefits would absolutely strongly depend on where you live. Okay, that has a lot to do with it. Now, if you choose an out-of-network provider, you will be financially responsible. In other words, if I went to work for a company and they were paying a health plan and I was going to their facilities and I chose on my own to go outside somewhere else, I would be financially responsible. It's the same here. Since Medicare is going to be paying a health plan to take care of you and they provide a network for you to get your care, and you go outside, you could be financially responsible. Okay, so that's something that's very, very important that you need to know. Okay, there are different types of Medicare Advantage plans. Some are health maintenance organizations, HMOs. Some are point of service plans, preferred provider organizations, otherwise known as PPOs, private fee for service plans, and Medicare savings account. Okay. Many Medicare Advantage plans in Southern California are the very first one you see on the screen, health maintenance organizations. Okay. And that is what Kaiser is. So let's talk a little about Part D. Now, I've actually been employed at Kaiser Permanente for several years. And I've been here so long that many years ago, there was no Part D. In other words, many years ago, a person would enroll into a Medicare Advantage plan, be able to go to the hospital, see their doctor. But when it came to walking into a pharmacy to get medications, there was no coverage. And it was a very challenging part for several seniors. Today, that's not the case. When a person enrolls into a Medicare Advantage plan, they are provided Part D drugs, okay? It also means that if you are not enrolled into a Medicare Advantage plan and you are enrolled into a health plan with your Medicare, please, please, please be sure that you are covered for medications. You are covered for a prescription drug plan. Now, to enroll, you have three options for enrolling in a Part D. A Medicare Advantage plan, such as Kaiser and several other Medicare Advantage plans. They would also include a Part D drug coverage plan for you. And many of them, like Kaiser, do not even have a monthly premium. You can actually enroll into a standalone prescription drug plan by itself if you have another health plan, and it's not a Medicare Advantage plan, okay? So, and you can also get Part D drug coverage through an employer group or a union if you have those benefits, okay? So, unlike Parts A and B, you can sign up for Part D directly with your plan. Part D is not directly offered through Medicare, okay? So there are Part D drug plans out there you can sign up for. When you do enroll into a Medicare Advantage plan, such as Kaiser, we include that and give that to you, and it's very cost affordable for generics and brand drugs. Now, something you also need to be very careful, and I do want to mention this. If you are eligible for Medicare, you should, if you do not have credible drug coverage through your employer or your spouse, you should sign up for a Part D drug plan. If you don't, it could lead to a penalty later on. Now, enrolling into a Medicare Advantage plan, okay? Oops, let me back up here. My screen got a little strange here, okay? Part A and B late enrollment into Medicare, okay? If you do not sign up for Parts A and B when you first become eligible, okay, let me move my screen here. All right. When you first become eligible, you can sign up between January 1st and March 31st, okay, for a July 1 effective date. I mentioned that earlier. If you don't sign up for Part B when you first become eligible, you're going to have to wait till next year, the first 3 months, for your Part B, okay? And then you'll start your Part B effective July 1. That's okay. Now that triggers a special enrollment period. And that means that there are certain events such as loss of employment or retirement that allow you to enroll into Medicare Advantage plans. Okay. Now, one of the great things, and I'm so proud of Medicare that they do this, is they offer what is called extra help, or it's also referred to occasionally as low income subsidy. And let me tell you what that is. Low income subsidy or extra help helps individuals pay for, if they qualify, for their medications. We all know that there are certain medications out there that can be very expensive, okay? And when you qualify for extra help through Medicare, okay, and again, Medicare is through the federal government, it's not through the state or Medicaid, then you'll receive a discount on your medication. There are different levels that you may qualify for. And depending on the level you qualify for, you would be paying a lesser amount for your medications if they're generic or brand, okay? Considerably less, even less than what health plans offer. Okay, so it's very good to take advantage of that. So let's read this here. For Medicare beneficiaries with limited income and resources, that's what extra help is available for. It provides extra help for Part D premiums and outpatient drug copayments. Okay. The degree of help depends on income and the resources that you have. Additional facts about extra help you need to apply at Social Security or the state Medicaid office, okay? It's administered by CMS, Center for Medicare and Medicaid Services, and you must be enrolled in a Part D drug plan to get help, okay? So it's available for you. I've met many people in the years I've worked here and that are not even Kaiser members, and they'll tell me, wow, I'm on this medication. It costs so much money. It's real. I said, have you applied for your extra help? You may qualify. And I encourage them to contact Social Security or Medicare, CMS, and they apply and they call me back and say, you're not going to believe this. I got the extra help. They actually gave it to me. Well, that's very good. I'm glad. So there are resources out there if you qualify for. Okay. That's very good. Now, to find out more about Medicare and what they have to offer, and if you qualify, I encourage everyone to plan ahead. And the reason is also, in the last year, I don't have to tell you what we've gone through as a society. We've gone through so much with the pandemic and COVID and the whole thing. The time to get certain things done have taken much longer, okay? And understandably so, So if you're becoming Medicare eligible, I would say in the next 4, 5, 6 months, start doing your homework now. Start getting things done early. Focus on getting your Medicare at a sooner date so you're eligible. I have spoken to many, many, many people in the last year that were in a bit of a panic. Manny, all this is going on. Well, I'm over 65. I have to apply for my Part B, and I just realized I'm going to lose my coverage next month, and I don't have my B. I need to hurry up and I need to get a hold of Social Security and apply. And Manny, it's taking forever. What do I do? Well, plan ahead, okay? Especially if you're becoming Medicare eligible in the future. I cannot emphasize that. And on the screen, you're going to see some good websites here. Write these down or take a snapshot. Get your camera and snap that picture. It's socialsecurity.gov. Okay. Absolutely one great resource is Medicare itself. Go under Medicare.gov. Under Medicare.gov, it does a wonderful job of breaking down all the parts of Medicare. Okay. And one thing I love about Medicare.gov, it will help you make a decision as to which particular health plan to select. Because one thing Medicare does is throughout the year, they evaluate health plans. And when they evaluate health plans, they're very straightforward in telling you how they're rated. They actually do what's called the star rating of each individual plan. And there are plans that are given a 1 and 2 star rating that really need some improvement. And there's 3-star ratings and 4-star, and very few that make it to a 5-star, an excellent rating. So I encourage you to go in there and look, and it will help evaluate as to what the ratings are for each one and what decision you can do for that. Okay. Also, don't be shy in getting a hold of Social Security directly. 1-800-772-1213. That's definitely their number. And they're available from 7 to 7, Monday through Friday. And 1-800-Medicare itself can also be contacted. And also, when you receive your Medicare card, you'll be receiving this Medicare and You handbook. That is a lot of good information in there. You want to hang in there and read that and go through it and really help you understand. But also, I encourage you to also write my information down. So if you do have a question, a concern, you're not sure, should I do this, should I do that, or any doubt, please call us. My number's right there on the screen. Take a picture of that. There is my actual email, manny.d.rivera@kp.org. KP's for kaiserpermanente.org. All right, my website right there. Or give me a call directly, okay? My phone number is area code 818-968-1575, okay? So I would absolutely not be shy in taking that and writing that down, okay? You absolutely want to do that. So I encourage you to write that down and don't be shy. Medicare for many people can be very, very confusing. Our goal here is to make it simple for you, and it should be as simple as possible. I've met many people that have been receiving Medicare and didn't understand it. They sort of put it away and thought it was going to go away, and they were all confused, and they were literally paying for something they didn't need. They were wasting money and time, or they needed health coverage and they didn't have it. They were on traditional Medicare and they had to spend a day in the hospital and pay a lot of money. And there was all this confusion. So our objective here at Kaiser is to simplify things for you and to help you and to answer your questions. Okay. We'll be glad to share information about our organization. We're available there. We're also, of course, throughout the Ventura County area, the Los Angeles County area, the Ventura County area. So I'm very, very glad that we've had this great opportunity to be a part of this time. And again, I want to reach out especially to the city of Fillmore for opening their doors and taking this opportunity to allow us to come in and just share this with you. Okay. And as I tell all my friends, with what we're going through, I want you today to be positive and test negative. Okay. All right. You take care of yourself, and please be safe and have an amazing and wonderful day, and be good to each other. Okay. Bye-bye now. Thank you.